Well, my name is Dr. Ibrahim Wada, and I'm the Chief Executive Officer of Nisa Premier Hospital and the Nisa Medical Group. And we're in the healthcare space, which comprises direct services to patients in terms of medical care, pharmaceuticals, laboratory testing, and even genetics. So we have a wellness center as part of our group that ensures vitality and quality of life, longevity, and prevention of diseases. There was a drastic reduction during the lockdown of clientele. More so too was that more and more people were coming who we suspected had COVID-19. So testing and referral to the necessary centers was also a challenge. In terms of our earnings, that naturally dropped, especially when we were also trading imported materials from the outside world. That was somewhat affected as well. So supplies, clients, money, they were all challenges. And disease, of course. So how to keep our staff safe and prevent our patients from having diseases also was another challenge. But we look back, we thank God not just for ourselves, but the whole country. We are not as badly affected as many other, even more developed countries. The world started a virtual world, so we started building access to our patients, meetings, business meetings, and many things that we would have traveled for. We did them virtually. That was one aspect that was a good development. Improvement in our financial management was necessary because they said that necessity is the mother of invention. So we had to innovate ways and means of managing lower finance. Protection gears had to really be a focus of our care, what you call universal safety precautions. So everybody became even more conscious. And thank God now that we are talking about vaccination and so on. So we are pushing to the public and pushing to our staff to get vaccinated against the pandemic so that there's more safety for all. Well, the basis of our plan for the future is a belief that Nigeria can and Africa can look after their health care without necessary recourse to the wider world. And we want to be leaders in that. 200 million people. Our company wants to be one of those recognized on the continent of Africa because we are the most populous nation, the number one economy in Africa. We have no business being second rate when it comes to healthcare for our people. So we want to expand. We want to improve our quality. We want to improve our brand name. And we are getting so many good young men and women, Nigerian and non-Nigerians, to come together to deliver what is expected of Nigeria in the global perspective. I am proud of what others have done in other industries like banking and manufacturing. Why not health? That's the motto. Our mission is to be African and to be high standards. Our relationship with Access Bank began in 2013. We haven't looked back since. So I'm very proud of the fact that we chose the correct partner. They partnered with us to expand. They also partnered with us in the ultra-modern hospital project we are building in Maitama that should equal what you find anywhere else in the world through CBN and Bank of Industry Finance and their own partnership finance as well. So I have nothing to say except that these 7 or 8 years of relationship with Access Bank has been nothing else but positive. We are proud. We look forward to the future because we too want to expand. And having learned about each other all these years, I think trust has been built, goodwill has been built, and the future looks very positive. I appreciate the bank for lowering their heart of mercy, if you like, during the pandemic when it was not business as usual. And I think that kind of sensitive organization is all that we needed, and we are proud of what they've done. And I hope they are proud of what we've done too.